I'll talk about ethics. So, and again, we're going to start in a very basic way and we're going to build up. All right. So hopefully now everyone is seeing my screen share. So let me just say again, this webinar is an overview. This is a quick overview. It is not a thorough treatment of the topic. And I do not want anyone who comes to this webinar to go out and say, now I am an expert in ethics. Okay? This is a first, in English we would say this is the first bite of the apple for some people. Although if people who went to a counseling program have already taken. So let's look at some, let me get you guys involved. So maybe I want you to write your opinions in the chat. So we're gonna look at some scenarios as we go along. So Chaw is a peer counselor. He's a mental health supporter. He sees a client for depression. And in the fourth session, they're working, the client's describing his symptoms, coming for sessions. And in the fourth counseling session, Chaw finds out that the client supports a government and has many views that Chaw doesn't agree with. Chaw is angry, so angry. And he cancels future sessions with the client. What do you think? Please write your opinion. Is that ethical, unethical? You don't know? What do you think? Again, if you think that it's okay that is ethical behavior, please type a 1 in the meeting group chat. If you think it's not ethical, you could type a 2 in the meeting chat. What do you think? Now, okay, so that's 2 people. I think we have about 40 people. Okay, we always have choices, Han. We're always making choices. We're always making decisions. Okay, now, many of you clearly think, and I want you to know, ethical dilemmas, we call them dilemmas because they are not so clear. It can be very difficult to deal with ethical issues, and I want to start simple. I'm not going to tell you, but for those of you who are typing a 2, why? Why? Why is it not okay? If it's your opinion that this is not okay for a counselor, why? What is your reason? We're going to look at a lot of cases today. I just want you, I'm not, okay. Ute Ong, go ahead. Very briefly, why do you think it's not okay?
Because of Joe does not Joe does not agree that yeah, I mean, I'm sorry, I don't understand. I sorry, I'm misunderstanding.
Okay.
Joe angry. I read it's angry, not angry, not agree. This is agree. So not agree. So maybe he can refer to another counselor. If if he not agree,
Okay.
maybe he can refer. Sorry. I
Okay.
read there
Okay.
the agree and angry. Sorry.
Okay. Thanks, Uteong. So yeah, Uteong mentions another option, referral, right? But we're looking at this one. He cancels the sessions, right? So let's go on. I have a lot more examples. Here's another one. This is another one. This is a little bit more complicated. A 42-year-old man comes to counseling for depression. In the third session, he reveals that he is gay and he has a long-term boyfriend. No one in this man's family, including his wife, knows that he is gay. The counselor disapproves of homosexuality and plans to tell the man's wife. So this is a dilemma, and the important questions are, what are your professional responsibilities as a counselor? And what is your professional role? And this is the new mentality for many mental health supporters, because your personal values and moral judgments are not relevant when you are in the role of a counselor. Now, of course, there is a difference. There is a difference. Let's look at another one. Or so personal ethics, and all of you have your own personal ethics. It's based on personal values. The judgments you make every day, the things you agree with and disagree with, are based on your personal values. Now, professional judgments are based on professional values. And this is very important. And this is, so I'm making a distinction. I'm separating personal from professional. And now, where do we get? So, a personal value comes from my family, my personality, my culture. That's where my personal values come from. And that's not a problem. It's right. That's we all have that. That's as human beings. But so where do my professional values come from? Well, in counseling, it's very easy because we have ethics guidelines. This is a statement of our professional values. We have a set, and in counseling, the guidelines are pretty, they are very clear. It doesn't make everything easy, but we have these guidelines to help us understand when I am acting as a counselor, what is my value? What is my guideline? So our personal values are influenced by my personality, my family, my cultures. My professional values are related to roles and responsibilities. In this case, of being a counselor. So these two words are really important: role and responsibility. This is the core of thinking, of developing. When I teach my students, I teach my students to develop ethical awareness. Ethical awareness. And part of the core of ethical awareness is understanding the role and the responsibility of a counselor. Now, I also understand, and let me understand that like a mental health supporter, maybe you feel you're not a professional. Maybe you feel, well, I'm not a professional. And, you know, I'm going to use the term peer counselor here. I don't always agree with the term lay counselor. I don't like that. I'm not comfortable with the term personally lay counselor, but I know there's many different kinds of counselors, right? But I'm going to say that a peer counselor or mental health supporter is what we call a para-professional. Para is a Greek word that means part, right? You may see that in other English words like parachute or paraplegic. Um, so peer counselors are paraprofessional. Now, what's the difference between a professional counselor and a peer counselor? So part of the difference is a professional counselor has a degree, like a master's degree. The most common degree for counselors around the world is a master's degree. They usually have some supervised experience. So now we're going to talk about this in a little while. Um, Agnes, when you did your internship, how many hours did you have to do for your internship? Do you remember?
Yes, individual 150 hours from
Okay,
assumption requirement.
there you go. 150 hours of counseling or of internship. Okay,
Yes.
great. And, usually I can tell you when we'll talk about this in America, most people have, before they can get a license, they have thousands of hours. That's the usual training and a requirement. They see many different clients and they have a supervision with a senior person. And usually they have a ratio, like for every 1 to 6, 1 to 8, or 1 to 10. Like for every 6 hours you see clients, you have to get 1 hour of supervision. Or for every 8 hours you see clients, you have to get 1 hour of supervision. Or for every 10, something like this. It depends. It's different in different places. My ratio, the ratio in the programs where I was educated was 1 to 8. For every 8 hours of training, I had to get 1 hour of supervision. So I usually receive 2 or 3 hours of supervision every week during my training. For every 1,000, for every 800 hours I spent in my training or seeing clients, I receive about 100 hours of supervision. But again, and what's really important is all of these professionals, they have a course in professional ethics. I had a long course in professional ethics, and I had to attend many seminars about professional ethics in my training. People, many of you on the Serenity team, some people went to Assumption University. The people who go to Assumption University and get the MSCP at Assumption University, they have a course in professional ethics in that master's program. Every single program that offers a master's always has a professional ethics training. Now, paraprofessionals usually have what we call certificate training, right? They take a course, maybe it's 20 hours or 30 hours or 40 hours or longer, and they get a certificate. They don't have a degree. They have some limited experience, maybe a dozen hours with clients or 24 hours, or maybe no hours, just practicing with other people in the course. They have received limited supervision, and usually there is no training in ethics in a certificate program. And we don't have licenses for paraprofessionals. So there's a big difference here. So it's when you start as a paraprofessional, although hopefully you have learned the most important thing, which is basic counseling skills. Because the truth is, the funny thing is this basic counseling skills are so powerful, so effective, that research shows that paraprofessionals can be equally effective. Paraprofessionals who have learned basic counseling skills can be equally effective as professionals, which is why there are so many trainings now. As long as 3 conditions are met, they have good basic training in counseling skills. They have proper supervision as they develop their skills, and they know something and follow ethical guidelines. They know something about ethics and follow ethical guidelines. So I know you think, oh, you know, Agnes has a master's degree and has experience, or Dr.Ben, has a PhD and has experience. But the truth is, research is clear. If you do some very simple things, you can be equally effective in many cases, not in all cases. There are some cases where we need to make sure we refer. Utaeong mentioned this word referral, where we refer to the professionals. And we'll talk a little bit more about what that is. So please have confidence in your basic counseling skills. These are a valuable resource, and if you work and develop your basic counseling skills, if you participate in supervision, and if you learn a little bit about ethical guidelines, you will be able to help a lot of people. There's no doubt about that. So, remember I said there's these 2 important words, role and responsibility. When acting as a counselor, you are in a counseling role. And this role has unique responsibilities. It has responsibilities that are different than other relationships. And we need to understand that we're still, I'm still myself when I'm a counselor, but I have some additional responsibilities. And I don't always act like myself. When I'm with my clients, I don't necessarily act or say the same things as I do at home with my wife or when I go out with my friends. Why? Well, because I'm in my role as a counselor and I have certain responsibilities in this relationship. Now, let's begin. So your role in the relationship, your primary role, is to perform counseling. It's very simple. That's your role. Perform counseling and use counseling skills properly. That's your role. Now, what's your responsibility? As we mentioned already, the ethics guidelines tell you what your responsibilities are. Now, this issue of ethics guidelines is a really important issue. We need to know them. Everyone needs to know them. And I really appreciate, for example, I know that Ong Min Tain at Counseling Corner, Ong Min Tain has established a set of ethical guidelines that he shares, and all the counselors at Counseling Corner has to follow those ethical guidelines, right? And that's something very important. That's something very, very important. We all need to have, it doesn't matter, there's many different kinds of codes of ethics. There's the counseling associations, psychological associations, therapy associations. I could bring you Australia, Canada, America, it doesn't matter. I'm going to try and make this simple, because if you start reading the code of ethics from Australia or America, it gets very complicated. It really does. I'm trying to make this cheat bit very simple and very concrete. So let's, how about this? Let's look at another case. And again, I want you to write your opinion in the chat. Chaw, I'm just using the name Chaw. I'm not speaking about a specific person. I just picked a common Burmese name. There's no person. Chaw has a new client who is suffering and can't sleep and feels anxious all the time. After the session, when he is at home, Chaw talks to his neighbors about what the client told him. I see it. What do you think? Please write in the chat. And if you feel it's unethical, why? What is the ethical issue? Because the key is not our final judgment. It's why. Okay, so Cosette says no confidentiality, right? So we have this idea, and many of you, I think all of you already know this. The people I've talked to, you've all been trained about confidentiality, which is one of our core guidelines. Yes, right? So you all already know that. Well done, right? Okay, how about this one? Chaw takes a one-day workshop on listening skills and psychosocial support. He starts to tell his coworkers and neighbors that he is a counselor and can help them solve their problems. What do you think? How about this one? So this is not about confidentiality. What? Han Tu-hen, I'm sorry, you're going to have to explain to me what a Dunning-Kruger effect is. I'm sorry, I'm not familiar with that. I apologize.
Well, Dunning-Kruger effect is like when you know something very little, you feel like you know like a lot
A
of things,
lot.
like many things. Yeah.
Okay. 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 Thank you. Thank you. Right. Appreciate your support. Right. Yes. And we see this among counselors a lot in America and Europe and this has to do with compassion. Well, sometimes people want to make money, right? And for other people, it's about helping. Yeah. So we have a way to talk about this. And by the end of the workshop, here, how about this? A 28-year-old woman comes to a counselor about depression. Then she asks her counselor to see her 5-year-old child. The counselor has no training or experience with children, right? I think this is very similar. It looks different, but it's very similar to the one we just talked about. Clients will constantly ask you to do things you have no training to do. That is part of the job. And that's not a problem if you know how to handle it. Hear about this one. This one, Sombat. Sombat completes a 6-week online course in counseling skills and peer support. And Sombat's cousin asked Sombat to give counseling to her 6-year-old daughter who's having problems sleeping. All right, these kind of cases come up all the time. Here's another one. Here's the same Sombat. I used a Thai name, so I'm not always using a Burmese name. Sombat completes a 6-week course in counseling skills and peer support and begins accepting counseling clients. When the clients come for counseling, Sombat also advises them to go to the temple, make merit, and speak with a monk for advice. Some people contact him who are not Buddhist. Sombat refuses to offer counseling to those people. What do you think? There's actually a lot going on in this example. There's several different things that are problematic. What do you think of this? Please write in the chat or unmute. Feel free to unmute and just give your opinion if you like. Any opinion? Looks like a kind of discrimination. What about telling his clients to go to the temple and speak with a monk? Is that, what do you think of that? Or again, if we could, it could be go to the church and speak to a priest, or go to the mosque and speak to an imam. What it doesn't, none of those would be different. Ooh, what did you just write, Agnes?
Sorry, I was telling if
So,
they want to answer in Burmese also, it's okay. Sometimes
oh,
it's
thank you.
understand,
Yes,
but better to express
yes.
in Burmese. So it's okay to answer or ask in both languages. Thank you.
Thank you so much, Agnes. Absolutely. Thank you. Thank you. Please, if it's easier for you to type in Burmese, by all means type in Burmese. So that, in my opinion, there's two different issues here. One is about boundaries, what we call a boundary issue, about telling people to go to a monk and go to the temple. And the other is refusing counseling. Yeah. So we're going to talk about these guidelines. I think you all already know about this. We talked about this. Guidelines are really important. They help us with our role and our responsibility. So I'm going to talk about 5 core guidelines. These guidelines appear in all ethics codes for counselors. No matter what, they may use different language. They may use some different vocabulary, but no matter where you go, whether you go to Spain or France or America, Canada, Australia, whether you go to counselors or psychologists or social workers, all their ethical guidelines will include these 5 topics that we're going to talk about today. Just to introduce you. Number 1, client welfare. Number 2, confidentiality that you all already know. Number 3, scope of practice or competence. Number 4, integrity and boundaries. And number 5, self-care. I think many of you have already heard about self-care as well. I know that that's a topic people are teaching a lot about, and I've taught a few webinars for Agnes on this topic. So let's talk about client welfare. So here is the guideline. Peer counselors must act in the best interests of their client, and that includes avoiding harm, providing competent counseling services that focus on the client's needs and goals, and sometimes it includes advocating for the client when that is helpful for the client. So, client welfare means do no harm. This is a very famous phrase in English. Do no harm. We don't do anything. When we were in the role as a counselor, we don't do anything that can be harmful to the client. This is the basis for confidentiality. Confidentiality flows naturally out of client welfare. Number 2, that we foster the client's mental health. We try to protect the client from harm, and we try to promote the client's best interests. And how do we do that? We try to provide interventions within your scope of practice. Because remember, as we'll talk about, if you try to practice outside your scope of practice, you may harm clients. And this is the difficult thing for many peer counselors and many counselors to accept, that we have a scope of practice. We have limits. So here's an example. A counselor sees a client for depression. The counselor finds the client very attractive. He makes up reasons to spend more time with the client. Maybe sends her some messages, asks for extra sessions, and he feels he wants to start a relationship with the client. Again, now, this is actually this is basically I hope everyone can see. Is this in the client's best interests? Maybe the counselor says, I'd be a very good boyfriend. I'd be a very good boyfriend. I would take good care of her. So this is, and I can tell you, because I've been doing counseling for 25 years, and I have had many experiences where I found my clients very attractive. Right? This is normal. this can come up when you're doing counseling. In graduate school, when I was working in our student clinic, uh, I had I remember the first time it happened to me with a client who came to counseling. I had to get a lot of supervision to learn how to separate my personal feelings from my professional behavior. But I had a good supervisor who helped me with that. And I did not, I could admit it. Some people might have too much ego to be able to admit that. Ego can be an obstacle to being an effective counselor. So let's look at another case. Cuckoo is a 25-year-old woman having a conflict with her parents. They want her to live at home and she wants to live on her own with some friends. Based on the counselor's own family and personal values, the counselor believes that Cuckoo should stay at home with her parents. What is the counselor's responsibility in Cuckoo's case? In your opinion, what do you think? What do you think the counselor should do in the case of Cuckoo? Cuckoo wants to live on her own. She wants to live on her own with her friends, and her family doesn't want her to, and the counselor agrees with her family. What should the counselor do? Han feels the counselor should let Cuckoo decide and not interfere with her choices. Han, what should the counselor do if Cuckoo says, "What do you think?" And people will ask you. If it didn't happen already, people will ask you, "What do you think?" And just, Han, I see your other comment. I now see your other comment counseling is full of tricky questions, Han. Um, and it's good to be able to slow down and think about them. I saw your statement in the chat. Counseling's basically acting when in the role of the counselor, we have to behave in a particular way. I think that statement is only true if you think that all of life is acting, because we all act differently in different contexts. I'm going to talk more about that when we talk about boundaries. But you act differently with your parents when you're at home than you act with your friends when you go out, and you act differently when you're at work, when you're talking to your boss than when you're talking to your team. Oh, that's normal. So a healthy adult has context-sensitive behavior. So our behavior changes in different contexts. I'm not sure that's acting. Or you could say it's acting like. So what we learn, one of the things we learn as counselors is what is the proper way to act as a counselor, knowing that there are many, many, many different ways to be a counselor. Agnes is a counselor her way, and I am a counselor my way, and we can both be effective. Mon, thank you. That's a great observation. One of the responsibilities of the counselor is to accept without judgment. It's basic counseling skills. That's not even, right? That's because we know that that's good for people to feel accepted and not judged. So actually there's the counselor if the counselor is not careful about this personal belief, the counselor might send the energy that she disapproves of Cuckoo's choice. Right? So awareness is very important, because I can tell you this, you will not agree with everything your clients say or do. You won't. But that you have to start to accept. Part of understanding client welfare is there's different ways to live a human life. Many different ways, right? Sexual orientation is a great example of this. And I think it's okay. Yeah, let me keep sharing my screen and let's look at another example. Now, here's one we already looked at. This is that same Chaw. Chaw is a peer counselor. His neighbor asks him to see her husband, who is a soldier supporting the government. Chaw refuses. He says no. Chaw accepts a client for depression. In the 5th counseling session, Chaw finds out the client supports the government and has many views. So Chaw cancels the sessions. These two are different. They are not the same. These two are very different, actually. How are they different? How are they different? Please write in the chat or unmute yourself. From an ethical perspective, these two are very different. What do you think? How are they different? And it's related to client welfare. What do you think? How are these two different? Thank you, Dr. Mon, right? Everybody see before starting the counselor-client relationship and after starting the relationship. Exactly, right? In the first example, the individual is not Chaw's client yet. Therefore, Chaw does not have any special responsibility to that person. It's okay. It's okay. You may not agree with Chaw. You may not agree with Chaw, but if Chaw feels like, and right, great. Thank you, Kai Tuai. You may discover that there are certain clients you can't work with. So for example, if Chaw will be so angry at the client, then he cannot support the client's welfare. And then that might harden the client if Chaw is always angry at the client. So it's better to say no and maybe refer in that example number 1. I have a very good colleague, someone I respect very much, who has dealt with so much trauma in his own life that he does not accept clients with PTSD, because that he accepts clients with depression, he accepts clients with anxiety, he accepts clients with many other different problems and relationship problems. He does not accept clients who have a trauma history. And he just checks before he starts a relationship with the client, because he feels he cannot help those clients well. This is actually the behavior of a really ethical counselor, to understand their scope of practice. Now, the second example here is a problem, because that's not good for the client, for the counselor to just abandon. We call this abandonment. The counselor in the second example, Chaw is abandoning his client. And you can't do that. Chaw has many options. Chaw can seek supervision. Chaw might eventually refer the client. Right? But this is Chaw has to now this is Chaw's client, and Chaw has a responsibility to support this client's welfare. It is the key responsibility. And as you say, especially if you work with teenagers, you will find many clients who do things you do not agree with. So confidentiality. So that's client welfare. Do no harm. Confidentiality, you guys already know about. I think you were taught about this. It just means we maintain confidentiality. Confidentiality is one of the most important principles in counseling. Why is that? Why is confidentiality so important in counseling? Again, please feel free to write in the chat. Please write in Burmese if you like. Please feel free to unmute and speak as well. Why is confidentiality so important in counseling? Okay, Wu Taeyong?
Confidentiality is protects the counselor and client.
How? How does it protect the counselor and client?
If we have the confidentiality, client more trust and
There you
more
go.
relationship.
There we go. Trust. It's about thank you, right? This is Nick, Nick and Siadanar are all on the same track, right? It's about safety and trust at two levels. The safety and trust of each client and the safety and trust of all clients. A counselor who breaks client confidentiality hurts all counselors and all clients. Because when a client hears a story like, oh, that counselor broke confidentiality and talked about their client, and then they think, well, I'd never go talk to a counselor. I'm too ashamed. Or people will judge me if they find out. So actually, the breaking confidentiality harms all of us. So it is the most important. But it's also about, you can see that it's related to the client's welfare. So that the client can feel safe and that the client will trust you and all of the clients will trust all of us. So it's very, very important. And we have to learn, I have been married for 24 years and and dating for 10 years before we were married. So my wife and I are together in a relationship for 34 years. I never speak with her about my clients. Just I want you to think about that for a second, because I realize, when we go out with other couples, I find it's very odd because they talk about their work, right? And they each know like what is going on at work for the other person, right? My wife knows almost nothing about what I do at work. Um, uh, and that's not a problem. She has never asked me, right? She has a lot of respect. She never asked me to talk about anything like that, and she never would, right? But this is a boundary, right? We're going to talk about boundaries in a while, but I want you to understand that confidentiality is a kind of boundary. I do not talk about my clients. There's only two reasons. There's only 2 or 3 reasons why we can break confidentiality. We can break confidentiality to protect someone. If we feel someone is not safe, we can break confidentiality, but there is a procedure for doing that. Or if we need supervision. If we need confidentiality does never, right? Because remember client well-being. We have to act in the best interest of the client. Sometimes, as you'll see, that means we need supervision. If we get supervision in appropriate ways, that's fine. That's not breaking confidentiality. Confidentiality does not prevent us from getting supervision. And also, we can get supervision without giving the client's name. We don't have to give every single detail about the client to get supervision. And this is very important. So this is one of the first ways where we see this unique responsibility. When we talk to our friends, and then we go talk to other friends, we talk about everybody. I talk with my friend over here about my other friend, and I talk with this friend about that friend, right? This is different, right? And and I think you all already appreciate how important this is. This is one of our core ethical responsibilities. So here's an example. Your client is a student who's cheating on his or her exams. You feel you should tell the professor. Unfortunately, you cannot make an exception to confidentiality. You can talk to your client about it. You can have a conversation with your client and explore this issue with your client, but there is no justification here. There's no justification to break confidentiality. Or here's another one. These are difficult situations. D comes to see you for counseling. He's married and has 3 children, and he's having an extramarital affair with a coworker, right? He's having a romantic relationship with a coworker. After the second session, you start getting messages on your phone from his wife. She got your phone number, and she's very upset, and she wants to know if your client is having an affair. So these are difficult situations that can come up in counseling. And and this is very important. One of the most important things you can learn to do in counseling is learn how to say no. You may not like it and you may be very uncomfortable and you may feel you don't like to do it, but it's actually something very important. So when people ask you about your clients, you have to find a way to say no politely, to not talk about it. When people, sometimes you have to say no to clients as well, or say no to potential clients. Saying no is one of the very important abilities of a competent counselor. All right. So that's confidentiality. I think you all are familiar with that, so I'm not going to spend a huge amount of time on that. So I want to talk about scope of practice and competence. This is the third core issue. And remember, if you have any questions as we go along, we've talked about client welfare and we've talked about confidentiality. If you have any questions, please send them to Agnes. Again, you can write in English or Burmese. You can send your questions to Agnes. So scope of practice, and in America we call this competence, but I like the term from Australia better, scope of practice. So competence has limits. Competence has limits, and a counselor and a peer counselor should practice within your scope of competence, and we refer clients to other professionals when needed. I'll tell you a secret. I have one question I ask people because I meet many professionals from many countries. People who say, I'm a counselor, I'm a therapist, I'm a psychologist, I'm a social worker. They come from all over the world: America, Canada, France, Germany, Belgium, Spain, Indonesia, Singapore, Australia, New Zealand. I have one question I ask people, and the way they answer this question, I make a judgment about if they are an ethical and competent counselor. I ask them, what clients do you not see? I don't ask them, what clients do you see? I ask them, who do you not see? Which clients do you refuse to accept? Like my friend I told you about, who won't accept trauma clients. Because I can tell you right now what clients I don't accept. Okay? I only work with adults. I'm not competent. My scope of practice does not include children and teenagers. I am not competent to treat children and teenagers. I have thousands of hours of experience. I have a license, right? I don't work with autism spectrum disorders. I do not work with ADHD. If a client says I want therapy for ADHD, I refer that client to someone else. If a client says my main issue is procrastination, I don't work with that client. I know many techniques to help with procrastination, but I have a huge problem with procrastination. And I have discovered after 25 years of doing therapy, I am not very helpful to clients with procrastination, right? So I have a list. I have a list of the clients I don't see. And so I ask, that's one of the questions that I ask everyone I meet who's a counselor. I say to them, who are the clients you do not see? And if someone says, no, I see everybody. Again, my response to that is, okay, well, now I understand you, right? You are someone who doesn't have proper training. You are someone who doesn't have a proper perspective about counseling. In my view, that's my opinion. I want you to know, please be aware what I'm sharing here is my view as a psychologist. Not every counselor agrees with me. Not every counselor agrees with me about this issue, but this is my opinion as a professor of psychology and counseling. Is that each one of us has a scope of practice. And if we keep learning and keep studying and get supervision, our scope of practice begins narrow. It begins narrow because that's normal. And then over time, our scope of practice can grow as we have more training and supervision. So how do we do that? How do we grow our scope of practice? Let's look at that because we can do this. So our scope of practice tells us what we can do, who are the clients that we are qualified to provide counseling for, and what we can't do, the limitations of our scope. When we need, so it also tells us, my scope of practice tells us when we need to ask for help, because sometimes we can see the client, but we need supervision. And our scope of practice can tell us when we need to refer. That we can't see that client, we can't help that client, and we might hurt that client. So let me ask all of you, I want all of you, for yourself, just for yourself, I want you to make a note. Right now, today, what is your scope of practice? Who are the clients? Please don't write in the chat. This is private. This is confidential. So please don't write in the chat. And you can write for yourself in English or Burmese. I want you to write down, who are the clients that you feel you can work with? Adults, children, teenagers, senior citizens, individuals, couples, families. I also don't see families. I used to see couples. I did have training in couples therapy, but I stopped. I don't like it. I don't enjoy it. When I worked in the hospital, we had to see couples. And then in my private practice, I saw couples for many years. Sumia, can you send your question to Agnes, please?
No, no, me too.
Oh,
I agree with you. I
oh,
don't
okay.
want to see this
And
happen.
and that's good, right? Because but hopefully, but I have colleagues. I have a list of my colleagues who do see couples, and when someone comes to me, I just refer them. Or when I have clients, and then they need couples therapy, I send them to somebody else. I don't do the couples therapy. I used to. Okay, so what for you? For each one of you, I want you to write down. Just take a moment. You don't have to share. And also you can think about the diagnoses, because when we begin, are you like which diagnoses, which conditions are you qualified for at this time? Depression, anxiety, trauma, autism, uh, schizophrenia. Yeah, so please take, uh, and again, this is an important part. I want you to notice how you feel when you do this, because you have to take your ego out. If you don't like to do this, the obstacle there may be ego. Like I don't like to admit I can't, I only can, because as a as a mental health supporter, especially if we only have 6 months of experience or 1 year experience or just a little bit of experience, our scope of practice will be small. That's not a bad thing. That's how we begin. Every big thing, every wonderful thing starts as a small thing. Every beautiful tree you ever look at started as a tiny little seedling, but it could grow and grow and grow. So there's no shame, but we have to be able to accept our limitations. So now, let's take a further look at this. So here's an example. Dr. T, here's a psychologist. He has a PhD. Dr. T specializes in individual and couples counseling for adults. He has no prior training about or clinical experience with children or teens. He takes a 3-day workshop and starts accepting teenagers as clients. Whether you realize it or not, this is not okay. Dr. T is actually breaking a standard. And I want to explain to you what the standard is. Or here's another example. Miss S has worked as an elementary school counselor and has extensive experience working with children and families, especially about school problems. So her scope of practice is children and families and school problems and related issues of children. And she's very good at it. She's very qualified. But a 52-year-old man with symptoms of PTSD related to being in prison comes to her for an appointment. He calls her, he messages her. What should she do? I think this is very important. We have to learn to say no. So I'm going to talk to you now about what we call the basis of competence. because there is a widespread misconception among lay people and sometimes among counselors that training equals competence. It does not. In counseling, like medicine, like being a doctor, just training and education alone don't give competence in an area. We have a formula for this. You need, so I'm sorry, and don't be afraid. There's no test. There's no test, so don't be afraid of the formula. But we say E&T stands for education and training. SE stands for supervised experience. And BC means basic competency. So what the formula is your education and your training together plus supervised experience equals basic competency. So let's use the example of Agnes, right? So I hope that's okay, Agnes. So Agnes got an MSCP. Sorry, this is very difficult to write on. So she got a master's degree, but she also had to get 150 hours of supervised experience in addition to the education and training. And maybe Agnes did more hours in other settings, right? In order to get her basic proficiency, her basic competency. Did you have other supervised experience, Agnes?
Yes.
Yeah, about how many hours?
It's almost 100 hours at the site supervisor from the Bangkok Refugee Center.
Oh, right. So you did, okay. So 250 hours, if not more. That's great, right? And of course, and this is the point when you reach basic competency, now you are a beginning counselor. This is not the end. Getting her MSCP and doing these 250 hours was not the end for Agnes. It was just the beginning. This is when you begin at basic competency. Now, for some of you, these numbers will be different. It's okay. It's okay for these numbers to be different. So just so you know, in many countries, and this is because counseling is hard, and you have to understand it takes a lot of practice. In many countries, you have to have a master's degree. And I can tell you in North America and in Australia, this is the number of supervised hours you need to have in order to get a license to be a counselor in Australia or America or Canada. Before they give you the license, you have to have a master's degree and 4,000 hours of experience. And I just want you to know that I don't want you to compare yourself to that, but I want you to understand, and I like what Agnes did, right? Agnes worked very hard, right? And she started with 250 hours of experience. And that's a really good place to begin. So you have to understand that these hours, and I want to encourage all of you to begin to keep a log. Begin to keep a private log. How many hours do you meet with clients? And what, like, how old is the client and what is the issue? So you know, oh, I have this many hours with depression. I have this many hours with anxiety. I have this many hours talking about marital problems. So you start to know what you've been practicing with. And also keep a record of your hours of supervision. Because I think that number 250 or 150, that's a very good number to say, okay, now I'm a beginner. When I reach that number, now I'm a beginner. Don't be discouraged. There are wonderful things. And as that number grows, you will realize you will become more confident, and you will realize you will start to say, okay, actually, no, I know a lot about depression now. I know how to help different people with depression. Oh, I've learned a lot about anxiety, and I know how to help people with anxiety. Oh, but I don't know about autism yet. I don't think I can help someone with autism. Or I don't know about trauma yet. I don't know if I can help people with trauma, right? This is this is one of the keys. Knowing my scope of practice is one of the keys to being an effective counselor. So, um, so remember, as I've already said, if competence in one clinical area or with one population does not imply competence in another area. So just because I know how to treat clients with depression doesn't mean I understand PTSD. Adults are very different than children and teenagers. We need special training, especially to see children. And of course, individuals, couples, and families. So we all have limits. We all have limits, and we should be able, I can tell you my limits like that, even after 25 years of working as a professional psychologist. I can tell you my limits. And remember, the counselor who does not recognize their limit is more likely to hurt the client because they do not know the proper treatment. And this goes back to client welfare. We shouldn't do anything to hurt the client. Basic counseling skills are very valuable. We can listen to people, but we don't always know the proper treatment. So there's two keys. Key number one is seeking supervision. This is how we develop. This is how we develop. So someone, as I said to you before, someone who has 4,000 hours of experience, if they were on a 1-to-8 ratio, they also have 500 hours of supervision. Just think about that. That means they spent 500 hours also sitting with a supervisor. Or we have different kinds of supervision, actually. Just please be aware of this. We have supervision from your single colleagues, and that can be individual supervision or group supervision. And we also have peer supervision, which is when we meet as a group. So when I was in my training, because I did internship and I did residency and blah, blah, blah. But again, my pathway is different. I did situation where I would meet with my supervisor one-on-one and talk about cases. But to be efficient, we also had group supervision, where the supervisor would meet with many students at the same time, and we would all hear the case discussion. This is probably one of the best methods, because we can learn from different people receiving supervision. But again, we really have to let go of our ego and be ready to receive feedback in the group to benefit from group supervision. Also, we can do peer supervision when we don't have, if we want to learn and we have people at our same level who want to learn, who are learning, we can all sit together and talk about cases and see what we think. Or, and I've done this many, many times, especially after moving to Bangkok, we created collegial supervision, peer supervision, where we pick a book and we read a book together as a group of therapists. And then we talk about the book, and then we start thinking, how can we apply this with our clients? I had many times we meet as a group once a month or twice a month that we did for 5 years or 6 years. Also, I want you to know, I still have a supervisor. And I want you to think about that for a second. I have, well, I don't want to boast. I have a lot of experience, right? I have a lot of experience as a therapist. And I'm an Ajahn, right? A teacher. I'm a Saya, right? I'm a teacher as well. I have a supervisor. And I meet with my supervisor. She's someone in America. She's very senior. She's around 70 years old, 75 years old. I have been meeting with her for 10 years. I had a different supervisor before her, right? And I meet with her. Now I meet with her once a month or once every 2 weeks, where we talk about the cases that I find difficult. Because yeah, there are cases that I find difficult. That's always true. And I'm very happy to have that support. And I pay her. I pay her an American rate for my supervision. She doesn't do it as a volunteer. So um, that's another question I ask people when I meet other therapists, or if they want to work in our group. I ask them, do you participate in regular supervision? And who are you getting your supervision from? But the first question is the one I already told you. So supervision, again, you don't want to get, if someone thinks, oh, I don't need a supervision anymore, I'm an expert, this is usually a sign of ego, right? One of the characteristics, there's actually research, there's wonderful research, and there's some good YouTube talks about it by a Canadian psychologist named Donald Meichenbaum. And Donald Meichenbaum studies master therapists. He studies the people who are considered like the very best therapists. They go in a community and they ask the colleagues, who's the best therapist in your community? Not just who's the most famous or who's the professor, but who's the best. Because very frequently the best therapists are people who are not ajahns, not professors. And then they do research on these people. One of the characteristic of the master therapist is lifelong learning. It's one of the characteristics. They're people who never, ever stop learning and still going to workshops and going to supervision. And sometimes they're teachers as well, but they're still learning. So this is just FYI. So supervision is essential. So when you have a client, you need supervision, right? And it's always a good thing. And there's a skill to learning how to use supervision well, but I think that's a separate lecture. Remember, as I said before, it's okay to say no. Referring, so don't allow your clients, your peers, your family members, or your friends to pressure you because you feel anade. This is very, very important. You have to learn to say no. And you can find a way to do that is face-saving. But this is proper and appropriate behavior. When you say no, you should be proud of yourself. Especially, so you refer to colleagues. So we all need a network. When I started working here in Bangkok, I joined a group. I never wanted to practice by myself. I never wanted to have my own office alone. I always wanted to make sure I have 5, 6 other people with a different scope of practice than me, with different preferences than me, so I can refer to these people and they can support me about the clients I can't see, and I can support them. So we all need a network. It's the people who we refer to and people who refer to us. So please make sure that you have a network, that you have a network of people and okay, you know what, this client is very suicidal or this client is very psychotic, and I don't think I can help this client, but I can refer to Agnes. I can refer to Ong Mintain. I can refer to someone else. Because sometimes also as a mental health supporter, it means that you have to refer to the professional. Because some cases are outside the scope of the mental health supporter, the peer counselor, especially psychotic clients or clients with serious suicidal ideation. Okay, so okay. Should we Agnes, do you want to take a quick break or should we keep going?
Maybe 5 minutes break for
Okay,
both
so
of you.
let's take a 5-minute break. Let's just take a
Okay.
5-minute break and we'll come back in 5 minutes too. So please stretch. We call it a stretch break. Just get up and stretch and move around, right? This is a form of self-care. And even when we do our webinar, we do some self-care, and we'll come back in 5 minutes. Oops. We forgot about that, right? Okay. Let me repeat that for the recording. So part of integrity means that we should always be honest about our credentials. We don't exaggerate, and we are always accurate. We don't exaggerate to make ourselves look good. And this is really, really important. And let me tell you why. I think being honest with your clients will win for you. Because here's the thing. When a client comes to you and says, What's your qualification? Well, how much training? How many clients like me have you seen? It's okay for you to say, I have a certificate. I am a peer counselor. I receive supervision. And I've seen 5 hours of clients like you. And I think that, now this assumes, I am assuming the client is within your scope of practice, not outside. Client is within the scope of practice that you feel comfortable. And you can say, I do believe I can help you. And I have good skills to listen to you. So I would like to be able to listen to you. And I think by listening and by talking together, I think that can be helpful to you. Because that's honest. I'm not saying if you come to counseling with me, I will fix your problem. That is not an accurate claim. We don't know if we can fix people, but we can do our best. In that situation, if you say that to the client and the client says, no, I don't think I want to see you, I want to talk to someone else, that's good. The client has the right to choose. And if the client doubts you, that's not a good place to start. And if the client hears you say this, you have been honest, and they say, okay, yes, I would like to talk to you, that is a very good beginning because the client is already putting trust in you. And remember, the person who exaggerates, the person who is not accurate about their qualification, the person lacks confidence. What they're creating is a fake image. Now, this is not an ethical issue. Lacking confidence is a common thing, but as a counselor, we want to grow and develop. And if you realize that you have, this is a challenge for you, that you are not accurately presenting your credentials, this is an issue you might like to work on. But like I said, many people are doing this these days. Many people are puffing themselves up and trying to present themselves as something very, very big. But we don't have to do that. We just be accurate. Be accurate, and remember, basic counseling skills can help a lot of people. So we describe our qualifications accurately. We don't exaggerate our training or our experience. This is very important. So here's an example. Chaw completes a certificate course to be a peer counselor for adults with a focus on basic counseling skills. He starts to tell his coworkers and neighbors that he's a counselor and he can help solve their mental health problems. So again, Chaw, I'm not sure why he's motivated here. I don't know if this is about Chaw's ego or if he's hoping to make money, which is it's a powerful motivation. But it looks like Chaw is not being accurate. Now, let's start talking about boundaries. And I want to imagine what you would do. Let's imagine you've been seeing a client, have a counseling session, and the counseling session finishes at 6 in the evening or 7 in the evening. It's a face-to-face. Or maybe you're online, I don't know. And the client says to you, hey, would you like to get a cup of coffee? Or let's go have a bowl of mohinga together. Or whatever people say. What would you do? I want you to imagine yourself in that situation. And how would you feel? What would you say? This is a boundary issue. And I want you to know very clearly, I will share you my opinions, but different counselors have different responses to this. And there isn't one single correct answer to this. Boundary issues are very complicated. Now, how about some of these? Would you ever hire a client to work as a salesperson in your family business? Let's say you knew a client and you thought the client was great. You thought this client had really good social skills, and your sister has a business and she needs salespeople for her business. So you think, oh, I'll introduce my client to my sister, right? Would you ever borrow money from a client or lend money to a client? Maybe if you got on the bus and you saw your client on the bus, would you sit together? What would you do? How about if would you give counseling for a coworker? How about for someone in your family? Would you give counseling for your brother-in-law or your sister-in-law or your cousin? How about would you answer your phone during the session? Would you accept a gift from a patient or give a gift to a patient? And I want you to know I have done both of these. I have received, because again, I have received gifts from clients, and I have on occasion given gifts to clients. But I want you to know always something relevant to the therapy, like a book on a topic that the client needs to learn. Would you have a long phone call with your client between counseling sessions? Would you ever hug a client or touch them in any way? Would you write a long email, sorry, or a long chat message? Sorry, I'm old, so I think about email. Would you write a long chat message to your client? So these are all boundary issues. And I'm not, this is a huge topic. And I want to say something right now. There's only one boundary that's really important. Well, no, that's sorry. Boundary issues are complicated. Boundary issues are really complicated. One of the boundary issues, and different psychologists, different counselors, and peer counselors have different responses, but we do not get involved. I just want to say that the one boundary issue I feel we can say is very clear. Counselors do not get involved in romantic relationships with their clients. And this is something to be aware of, because this does happen. Counselors do not, and that is an indication that is a boundary violation. Other boundaries are more complicated, but the key is not that you know the right answer. The key is that you have boundary awareness. That's the key. That you are aware of boundaries and you're thinking about them. So psychological boundaries are present in all relationships. And they define, our boundaries define how we interact with each other. We talked about this earlier because Han asked a question about this or made a comment. So parent-child boundaries. We have boundaries with our parents. There are things we would never say to the parent, or there's things a parent might never say to the child. That's a boundary. And if someone broke that boundary, we would find it so shocking, right? Like if I went to my mother, now I'm an adult, and I went to my mother and I said, "Oh, I hate you," right? We would feel like I had crossed a boundary, right? There's friendship boundaries. We have boundaries with our friends. We have spouse boundaries with our partners. And these boundaries are different across cultures. But these are present everywhere. Usually they are implicit, which means that people don't talk about them. They just live it. Usually, but in therapy, it's important that these are explicit, that we're able to think about them. And when we need to, we can talk about them. So I've already mentioned this one to you. A counselor is attracted to a client and wants to start a relationship with a client. This is not okay. And I think all of you are aware of that. But it happens. And the key is to be aware and know if it's happening to you or a friend of yours, a colleague of yours, so we can get help or we can give help. So the key is starting to be able to ask yourself, what is your appropriate role with the client? Now remember, we've been talking about your role and your responsibility, client welfare, client confidentiality, scope of practice. These are your responsibilities. Now we're talking about integrity and boundaries. So remember, your only function in your relationship with the client is to do counseling. That's your that's your primary responsibility. Do counseling ethically and responsibility. But especially as you have more and more experience, you will see that because counseling feels like other kind of relationships, sometimes counselors begin to forget this. So for example, sometimes a good counseling can feel like a friendship. We might even feel, because, openness. The client is very open with us. And sometimes we are open with the client. It depends on your style as a therapist. But we can have a feeling of closeness with our clients. The client feels like they share things with you they don't share with anybody. And you have a feeling like you know this person so well and you want to help them. So we have a feeling of closeness, and sometimes we get confused. We forget that this is counseling, and counseling is a limited relationship. So what is the appropriate function? And the guideline is counselors don't use relationship with clients to meet their own personal needs. For example, in our friendships, we use our friendships to meet our emotional and social needs. When I am feeling bad, I want to talk to my friends, or when I want to go out and have a good time, want to go out and have a beer and eat Japanese food with my friend and just forget about everything and have a good time, right? That's because I am a human being and I have emotional needs. I have social needs. All of us have these needs. And that's actually part of self-care. This is part of why self-care is so important. We also have other kinds of needs like ego needs, power needs, and status needs. So sometimes, and I'm not going to talk about this because this gets more complicated, but sometimes counselors may start using their clients to meet their ego needs. So this is really important, is we have to understand that we are human beings. And when we're acting as a counselor, we are temporarily putting aside our personal needs to focus on the client. A friendship, when we're in a family relationship, when I'm with my brothers and sisters, if we're in a healthy family, is a two-way relationship. I help them and they help me. I support them and they support me. Also, my friendships are a kind of two-way relationship. I support them and they support me. I'm friend for them and they're a friend for me. We need relationships to be our best. All of us. It's part of being human. Counseling's not like that. Counseling is not a two-way relationship. And we have to be careful about this. But we are supposed to be there for the client within limits. We are there for the client. We support the client. We do not ask the client to support us. Socially, emotionally, or for our ego and our vanity, right? So here's how you know your boundaries. Boundaries, you can think about boundaries as a kind of structure. Like so there's the time, the where, the focus, and the who will share. Like time. When do you see your clients? And for how long? Can the client call you at 1 a.m. in the morning? Can the client meet with you on Saturdays? So what is it? And when you meet with the client, do you meet with the client for 30 minutes? Do you meet with the client for 1 hour? Do you meet with the client for 2 hours? Or do you just do whatever? You have no time boundary. Because some people do that. Where do you meet with your clients? Do you meet with your clients in the coffee shop? Do you have an office where you meet with your clients? Do you meet with them at their home or your home? Again, but what is your boundary? Like a peer counselors frequently meet with clients out in public, frequently meet with clients. Peer counselors, usually professional counselors, usually have an office. But mental health supporters, peer counselors, frequently may meet with the client in the client's home. They may meet with the client in a public area. They may have some other space. That's not bad, but do you know what your boundary is? And again, the typically counseling sessions have a focus, that there is a topic, right? That is to say, the client has a goal or they have something they want from the counseling. And that's very important that we make sure there's a focus. That's a boundary. What is the focus? What are we here to talk about? It's not like with friends. We just meet with our friends and we don't know what we're going to talk about, right? We're there just with our friends. But in counseling, when we meet, there's a topic and we should know what is the topic. And again, who's going to share? Well, we know the client is going to share. Usually the counselor is not sharing so much. So these kinds of boundaries, and I know that this is general. I know that this is a little bit vague, but I cannot, it is perfectly ethical to have different kinds of boundaries. So for example, I see my clients for 50 minutes. My sessions are 50 minutes, 50 minutes, and then I have a little break, 10 minutes in between throughout my day. I have a colleague, her sessions are 60 minutes, right? There's no problem there, right? And we're both consistent. My sessions are 50 minutes with all of my clients, and her sessions are 60 minutes with all her clients. I don't have one client where I meet with that client for 30 minutes and another client where I meet with a client for 75 minutes. I do the same thing. And honestly, I do that because it's better for me. After 50 minutes, I can start to get tired. I also now in America, I have many colleagues in America who are doing 40 minutes or 45 minutes. So again, it's not a question, it's not what is the right amount of time. You have to understand this, but it's about what are you doing and what helps you be you, the best counselor you can be? What helps you be the best counselor you can be? And then you try to do that with all your clients. And of course, so these boundaries have three important purposes. Number one, they help you support people effectively. Number two, they protect clients from counselors taking advantage of them. And number three, they let us help many people without burning out. Because that's another thing we do as counselors. We have to listen to a lot of different people. In a given week, you know, a peer supporter, you might talk to 5 different people or 10 different people. As a professional counselor, I see about 20 people a week. Before COVID, I used to see more. Before COVID, I used to see something like 25 or 30 people a week, but I don't have the capacity anymore to see that many people. And so now I see about 20 people a week. And that's a boundary for me. That's a limit. I can't accept everyone who wants to see me as a counselor, but as a peer supporter, you know, you get to decide. But that's how we do that. With our self-care, we have a limit. I know that my limit is to talk to 5 people or 10 people. That also, again, and have some time maybe for emergencies. This is a quote by a man named Kenneth Pope. I think that Kenneth Pope's book, he has a nice website, but it's very technical. There's a website about ethics, Ken Pope. And he says, establishing safe, reliable, and useful boundaries is one of the most fundamental responsibilities of the therapist. The boundaries must create a context in which the therapist and the patient can do the work of counseling. Again, the word therapist here is generic. It just means counselor. That's all. Right? So I think that this safe, reliable, and useful boundaries, and that's especially also, this is a kind of interesting thing. And I think it's helpful to clients because clients know, they know this is how long the conversation is. This is when the conversation will happen. They know I can't reach Ben at night, so I'll send him an email. Right? They know they know my boundaries. They know my boundaries because I don't know if you've learned about this, and maybe you don't have to do this, but I just want you to know that professionals, we have a counseling contract with all of our clients. We call it different things. Some people call it informed consent. I call it agreements. But basically, you have an agreement with the client that defines your boundaries. So the client knows how best to use you. So what is the length of the session? What is the place where the session happens? How you can contact each other, right? If there's a fee, if you're charging a fee, what is the fee? And all these kind of details. This is our agreement. We have an agreement between us. All of these things are boundaries. And you don't, different people, and if, again, even if you have no fee, it can be useful to have this kind of agreement. So we set appropriate, clear, and consistent boundary with the clients, and we don't change those boundaries without thinking about it. Because if you have a different boundary with one client, this is usually a yellow flag. If some reason well, like you have 10 clients and 9 clients you have the same boundary, but one client you have done something different with, we should ask ourselves, what is happening? Why am I treating this client different? Is it about my needs or is it about the client's needs? It doesn't mean it's wrong. It doesn't mean it's wrong. And usually it's important to discuss with the client what we're doing. You don't have to use the word boundaries. I use the word boundaries, and if you go out in English and if you go in the English world of counseling, that people use the word boundaries. They will talk about counseling boundaries, therapeutic boundaries. You don't have to use the word boundaries when you talk to a client. If we use that word, the client may not understand. So, and clients will challenge our boundaries. Clients will ask for more time. They will ask for special favors. They will give you gifts, and they will invite you to things. They will ask you personal questions. Please understand, the client's not doing anything wrong. This is normal social behavior. It's normal social, and you get to decide, because again, it's not going to the client's wedding is not unethical. There's nothing wrong with that, but you just might decide you don't want to do it. If you do it because you feel pressured, that's not necessarily a good thing either. So, and what do you use? You use your ethical guidelines, your clinic policies, if you work as part of a clinic or a network, and your personal preference. Like, for example, there's another example like time boundaries that are, it's not an ethical issue, right? I have a colleague who sees all his clients starting at 6 in the morning until around lunchtime, and then he stops working around lunchtime. Right? So that's CC's, 6 o'clock, 7 o'clock, 8 o'clock. I don't start seeing clients until 10 or 11 in the morning. Because when I get up in the morning, I want to drink my coffee and I want to meditate and I want to exercise. And I only do those things in the morning. So I set up my schedule. And if the client says to me, I have to see you at 7 in the morning, I say, I'm sorry, I'm not available at 7 in the morning. And I don't suddenly change that for one client. I say, well, I have my colleague. Let me give you the phone number of my colleague. He is available at 7 in the morning. If you want to see me, it has to be on my schedule. And these boundaries help me. They help me. This is also part of my self-care. Because boundaries, as I mentioned to you before, boundaries can be about ethical issues, but boundaries can also perform a self-care function that lets us, I need to do these things so I can help 20 people a week. And I have an ethical obligation to take care of myself. Very important. Okay. So I think, yeah, no, I think that that's probably enough. I think that that's probably enough on those topics. So again, but that does just leave it with self-care. Self-care is very important. I can't emphasize it enough. I think many of you, if you've already been doing this work, you know that it uses energy. Listening, being fully present and listening deeply and interacting with people when they're suffering uses energy. I can feel very tired at the end of a session and at the end of a day. Even if I just sat in a chair all day and I listened to people, I can feel very, very tired. So self-care is very important. I experienced some burnout after COVID. In fact, I will be doing a LinkedIn Live event on December the 4th, where I'm going to talk about my experience because I'm a supervisor for an organization in Singapore. and they're doing a series about burnout, and I'm going to share about my own burnout experience for other counselors. But we all have limits. We all have limits in it. So self-care and making self-care a priority is an important part for mental health supporters, and figuring out those routines, because that means when we have good self-care, and again, we're not perfect. Good self-care means we come back to self-care, maybe not every day or every single week, but we always come back. When we have good self-care, it means it will make us a better counselor. We will have more energy and more space. Okay. So those are the 5 core areas that I wanted to share with you today, that are the kind of ethical areas to begin to be aware of for when your role and responsibility as a counselor: client welfare, confidentiality, scope of practice and competence, integrity and boundaries, and self-care. This is the kind of core ethical areas. And I'll be very glad to talk about any questions you have or any cases you might like to discuss. But if you do have a case, I prefer that you send that information, that we don't share that information publicly. You send that information to Agnes. You write it in Burmese or English. You send it to Agnes, and then Agnes can present relevant details, and I can respond to it. So if you have a question, you could send it to Agnes at this point, or you could raise your hand.
I will end the recording now so that the
Mm,
discussion will not
okay.
be.
Yeah.